Hello, welcome to another episode of Arthritis and You, A Joint Journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
Ever feel like you're playing medical detective? You know, just trying to piece together symptoms,
Right.
Googling like crazy?
Yeah.
Well, today we're tackling a condition that's practically made for mystery lovers, lupus.
Absolutely.
It's called the disease of 1,000 faces for a reason.
Yeah.
And we're putting on our investigator hats to figure out why, our case files, insights straight from Alberta Rheumatology, their website, and some really helpful explainer videos, so no need for dramatic reenactments or anything like that.
Right.
But let's set the scene. What exactly are we dealing with when we talk about lupus?
Think of your immune system like a crack team of detectives, right? They're supposed to track down the bad guys, viruses, bacteria, that sort of thing. But in lupus, these detectives get a little trigger happy and start mistaking your own WN cells for criminals.
Okay, so it's an autoimmune disease.
Yes.
But why the 1,000 faces thing? The website mentioned it can affect a whole bunch of organs, right?
Exactly. And that's where the real mystery comes in. One person with lupus might have a butterfly rash on their face, joint pain, and fatigue. Another person might have kidney problems, chest pain, and no rash at all.
Oh, wow.
It's like the clues are all jumbled up.
Making diagnosis tricky, I bet, especially since the website mentioned it's relatively rare, something like 0.1% of the population.
Right, and that's another layer of complexity for our detective work. Because it's less common, doctors might not immediately suspect lupus, especially in the early stages when symptoms can be vague.
It's like trying to solve a case with missing puzzle pieces. The website also mentioned it's more common in women, typically diagnosed in their 20s and 30s.
Right.
Any theories on why that is?
That's a question that keeps researchers up at night. Hormones are definitely a suspect. They play a big role in the immune system, and we know lupus is more common in women during their reproductive years.
But like any good mystery, there's still a lot we don't know.
Right.
Okay, so we've got this tricky disease that can mimic a lot of other things. How do you even begin to diagnose it?
Well, one of the first clues doctors look for is something called the ANA test.
Okay.
It stands for anti-nuclear antibodies, which are like little red flags in the blood that suggest your immune system is acting up.
So if the ANA test comes back positive, you've cracked the case, right? Lupus confirmed.
Not so fast. Remember, lots of things can make your immune system go a little haywire.
Yeah.
A positive ANA is just one piece of the puzzle. It's like finding a fingerprint at a crime scene. It tells us someone was there, but we need more evidence to identify them.
Speaking of evidence, the website's FAQ section tackled a question I hadn't even considered. Can you get pregnant if you have lupus?
It's a question we hear a lot. And the good news is, yes, I think it's possible to have a healthy pregnancy with lupus.
Okay.
But it takes careful planning and teamwork with your rheumatologist.
Teamwork, like a medical dream team.
Exactly. Your rheumatologist will work closely with your OB/GYN to manage your lupus throughout your pregnancy. Because here's the thing, pregnancy can sometimes make lupus symptoms flare up.
So you've got these two specialists working together to keep mom and baby healthy. That's reassuring. But what about treatment in general? Is there a cure for lupus?
That's the million-dollar question. And unfortunately, there's no magic bullet now. But the good news is, treatment has come a long way.
The website mentioned a whole range of options. From what I gathered, it seems like the goal is to manage those unpredictable symptoms and get you into remission.
Exactly. And that's where those different treatments come in. We've got everything from antimalarials.
Oh, wow.
Yeah, you heard that right. Originally developed for malaria, but they can help calm down the immune system in lupus too.
Interesting.
To immunosuppressants, which are like the big guns for really tamping down that overactive immune response.
Okay, so we're talking serious medications here. The website was very clear about not self-treating.
Absolutely.
Yeah.
This is definitely a talk to your doctor situation. They'll consider your specific symptoms, how active your lupus is, and your overall health to create a treatment plan that's right for you.
Because everyone's experience with lupus is different, right? Back to those 1,000 faces.
Exactly. There's no one-size-fits-all approach to treatment.
So we've laid out the basics of this medical mystery. But there's one more piece of the puzzle we need to explore. What are those environmental factors that might trigger a lupus flare? Because the website hinted that it's not just about genetics, right? It's like having a medical mystery, but there's a whole chapter on environmental clues.
Right.
It feels like something out of a Sherlock Holmes story, you know?
Uh-huh.
But instead of dusty old attics, we're looking at things in our everyday lives.
Precisely. And just like Sherlock notices a scuff mark on the rug, We're trying to spot those subtle things that might set off a lupus flare.
So where do we even begin? The sources mentioned a few usual suspects, right?
Absolutely. Sunlight is a big one. It's practically a cliche in medical mysteries, the shadowy figure allergic to the sun.
Right.
But in lupus, sunlight exposure is no joke. It's a known trigger for flares in many people.
Wait, seriously? You're telling me something as natural as sunlight can set off an autoimmune response?
It seems that way, yeah. The ultraviolet UV rays from the sun seem to mess with the immune system in folks with lupus, making those detective cells go even more rogue.
So much for catching some rays. That's a bummer, especially for people who love spending time outdoors. Is it as simple as slapping on some sunscreen, or are we talking full-on vampire mode?
Well, sunscreen is definitely a good start. It's not just about avoiding sunburn either. Even mild sun exposure can be problematic for some people with lupus. Think wide-brimmed hats, sunglasses, and seeking shade when you can.
Got it. Sun protection is key. What else is on our list of environmental culprits? The website also mentioned infections.
Ah, yes, infections. When your body detects an intruder, like a virus or bacteria, it sounds the alarm and sends those immune system detectives into overdrive. Now, for most people, this is a good thing. But for someone with lupus, that heightened immune response can backfire, leading to a flare.
It's like their immune system is saying, oh, you think this cold is bad, just wait till you see what I do when I really get going.
A rather dramatic response.
Yeah.
But you get the idea. Infections throw gasoline on the already smoldering fire of lupus. That's why it's so important for people with lupus to stay up to date on vaccinations and practice good hygiene to minimize their risk.
So we've got sunlight, infections. What else is lurking in the shadows of our environment, waiting to trip up those with lupus?
Stress is another big one. And I'm not just talking about the occasional deadline or traffic jam.
Yeah.
Chronic stress, the kind that lingers and wears you down.
Right.
That can wreak havoc on your body, including your immune system. And we know what happens when your immune system is out of whack, right?
Cue the lupus flare. It makes sense, though. When you're stressed, you just feel off. Your body's in fight or flight mode, pumping out all sorts of chemicals, and it's like it's too busy freaking out about a deadline to remember which cells are the good guys.
Exactly.
Okay.
And it becomes a vicious cycle because lupus flares themselves can be incredibly stressful. It's like a double whammy.
Okay, so avoiding stress is important, but let's be real, that's easier said than done.
Yes.
It's not like we can just tell our bodies to chill out. What can people with lupus realistically do to manage stress?
You're right, it's not a simple fix. But finding healthy coping mechanisms for stress is absolutely crucial, especially for those with lupus. Whether it's exercise, meditation, spending time in nature, or talking to a therapist, finding what works for you can make a world of difference. And honestly, that's good advice for all of us, whether we have lupus or not.
Absolutely. Taking care of your mental health is so important. Now, before we move on to treatment, I have to ask about one more thing. The website mentioned medications. Are you saying some medications can actually trigger lupus flares? That feels like a cruel twist.
It's true. There are certain medications, like some blood pressure drugs and anti-seizure medications, that have been linked to something called drug-induced lupus. It's not as common as other triggers, but it's definitely something to be aware of.
Hold on, I need to process this. So you're telling me a medication that's supposed to tell LPU could actually make things worse?
It's a rare complication, but it's something doctors are aware of. The good news is that drug-induced lupus usually goes away once the medication is stopped.
Yep.
But this is exactly why open communication with your doctor is so important.
Okay, that's a relief. Speaking of treatment, the website mentioned quite a few different approaches. What are some of the most common treatments for lupus, and how do they actually work? It's almost like lupus treatment is a balancing act, isn't it? You're trying to calm down the overactive immune response, but you don't want to completely shut it off.
That's a great way to put it. Remember those immune system detectives we talked about? They might be a little trigger happy in lupus, but we still need them on the case. When it comes to fighting off real threats like infections and things.
So how do you walk that tightrope? What are some of the tools in the lupus treatment toolkit?
Well, one of the most commonly prescribed medications is hydroxychloroquine,
Okay.
which you might know better as an anti-malarial drug.
Wait a minute, anti-malarials for lupus? That seems like something out of a medical mystery novel.
It might sound strange, but hydroxychloroquine has been used to treat lupus for decades. It helps reduce inflammation and calm down the immune system. It's often one of the first medications doctors will try.
So it's like taking the edge off those overzealous detective cells. What about those other medications the website mentioned, like immunosuppressants? When do those come into play?
Immunosuppressants are like the big guns of lupus treatment. They're more powerful at suppressing the immune system, which is necessary when lupus is more active or affecting vital organs like the kidneys.
Okay, so it's about finding the right level of intervention depending on the severity of the case. The website also mentions something called bisphosphonates. What are those all about?
Bisphosphonates are actually used to treat osteoporosis
Okay.
or bone thinning. They help to strengthen bones, which is important for people with lupus because some of the medications we use, like corticosteroids, can weaken bones over time.
It's like a preventative measure to protect your bones from the side effects of other treatments. It seems like lupus treatment is all about teamwork, and not just between doctors, but between different types of medications, too.
Exactly. It's about finding the right combination of therapies to manage your specific symptoms and keep those detective cells in check.
This deep dive has been fascinating. We've covered so much ground. From the basics of lupus to the complexities of diagnosis and treatment, and even those environmental triggers that can set off a flare.
Right.
I feel like we've learned so much, but I also have a feeling this is just the tip of the iceberg.
You're absolutely right. Lupus is a complex and often unpredictable disease, and researchers are still working tirelessly to uncover its secrets.
Well, I, for one, am eager to hear what they discover next. We've learned that lupus is a disease of many faces, affecting people in different ways. We've explored the challenges of diagnosis, the importance of a strong medical team, and the arsenal of treatments available. But most importantly, we've learned that knowledge is power.
Absolutely. The more you know about lupus, the better equipped you'll be to advocate for your health, manage your symptoms, and live a full and meaningful life. Don't be afraid to ask questions, do your research, and connect with others who understand what you're going through. You're not alone on this journey.
And on that note, we'll wrap up our deep dive into the enigmatic world of lupus. We hope this episode has shed some light on this often misunderstood disease and empowered you to take charge of your health. Remember, this is just the beginning of your exploration.
This has been another episode of Arthritis and You, A Joint Journey, brought to you by the Rheum team from albertarheumatology.com, your trusted evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Lupus, technical producer, John Iphone, and our executive producer, Stephen Cates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another Deep Dive.